Day and welcome to Chapter 9, Pre-Examination, Pre-Analytical Complications Causing Medical Errors in Blood Collection lecture. Today we'll be talking about pre-analytical pre-examination errors that can occur during blood collection. As you know, pre-analytical or pre-examination variables are particularly critical because most of them can be controlled by the healthcare worker. Most errors can be avoided by the phlebotomist just pays attention to his or her surroundings, properly checking a patient's ID for correct name and date of birth, correct spelling of the patient's name, and making sure that all information on the orders mix with what the ID bracelet has. Proper collection of blood samples is another way that a phlebotomist can avoid errors. To do not underfill or overfill collection tubes, properly invert tubes, and follow any special instructions on how to transport specimens. If test states that the tube must be protected from light, guess what you have to do? Protect that tube from light. Some variables that are important in specimen collection is always be aware of patient assessment and physical deposition of patient. The tests that are being requested: specimen collection, specimen transport, specimen receipt in the lab. Some variables can be controlled by the patient, including physiological variables and those directly related to specimen collection. Those are some that can be controllable factors. Some uncontrollable variables may include biological interference, such as age or sex, environmental influence, such as patient's geological location or altitude, because the way we collect blood in South Louisiana is not the same as if we lived in Colorado in the mountain areas where it's higher altitude. It may be a little different procedures that may be done up there. Other variables may be an underlying medical condition, such as stress or fever, can fall into the group of unavoidable pre-analytical factors that can impact a patient's laboratory values. Some major physiological variables that are controllable and can affect the results of laboratory analytes include diet, lifestyle, exercise, posture, travel, and prolonged bed rest. Basal state. Basal state is when blood specimens used to determine the concentration of body constituents such as glucose, cholesterol, triglycerides, electrolytes, proteins, and so on should be collected when patient is in a basal state, which is collected in the early morning 12 hours after the last time the patient has eaten. Tests that are performed when a patient is in a basal state are most reliable, but there are some factors that can affect the results, such as patient's diet, exercise, emotional stress, obesity, menstrual cycle, pregnancy, posture, tourniquet application, and chemical constituents such as alcohol or drugs can affect a basal state lab result. Always remember, it is very important that a healthcare worker understands the effects of their relationship to laboratory tests and diet. To ensure that a patient is in a basal state, a physician may require that the patient fast, which means an absence from any nutritional support such as food or beverages overnight. With further research, they have found out that a patient that has been fasting without nothing to drink makes drawing blood very hard due to the fact patients were becoming dehydrated. Patients must fast for at least 8 to 12 hours before a specimen is collected. And if by chance a patient has eaten recently, it is up to the physician to state if he still wants the specimen to be collected, even if the orders say that the patient is supposed to be fasting. If a procedure involves any discomfort or inconvenience, make sure that you explain it to the patient before testing begins, such as glucose tolerance tests. This test can be ordered by the doctor as a 1, 2, 3, or 4, or etc. test. It is important to explain the process to the patient and about how long that patient will be in the lab collecting specimens. Just because their order says a 2-hour glucose testing, it's really a 3-hour glucose testing because first of all, you have to collect a fasting lab sample, send that to the lab to make sure that their glucose levels are stabilized enough to give them the glucola to perform the glucose tolerance test. So we take a fasting sample, send it to the lab, get those results, and then we go from the 2-hour test from there. It can take up to an hour just to get those results back from the fasting lab. So technically, the patient will be in the lab facility for up to 3 to 4 hours, depending on how fast we get the results back from the fasting labs. Turbinate or lymphic serum, sorry. If a patient has eaten fatty substance, the patient can have a serum letter that is lymphatic or cloudy. A specimen that is cloudy shows a sign that the patient may have a temporary elevated lipid or triglycerides cholesterol level. Turbidity is primarily caused by indigestion of fatty substances such as meat, butter, cream, and cheese, or can occur when a lipid supplement is included in perinatal nutrition preparation. Most lipid level testing is now done when a patient is in a basal state, fasting state. If for some reason the patient is not fasting for a lipid level, it is very important for the phlebotomist to document the fact that the patient was not fasting, especially if their triglycerides or cholesterols come up at an elevated level. Obesity is another pre-analytical variable we can come across. A healthy body weight is based on body mass index or BMI, and for adults, the average BMI is 20 to 25 kilograms per meter square. Obese patients have a high BTM, and sometimes this can make finding a vein to draw very hard to find due to the high fat content that they have. And I'm not saying all obese patients because some obese patients have very good veins and some have poor veins. It just depends on the person. So everything you hear about an obese patient is not always true. It can be very stressful for the healthcare worker as well as the patient sometimes when we have trouble finding the vein. Most times the obese patient knows the best site to draw from, so it is always helpful to ask the patient where is the best place to draw because the patient knows their body better than we do. The phlebotomist may have to use a longer needle just in case they have a higher fat content, cause the patient's veins may be deep inside the arm due to high fat content. Please, and this is a very important afternote, do not, and I repeat, do not always follow the taboo. Some obese patient has great veins and as soon as you place the tourniquet, the vein pops up for you to draw with a regular size needle. So not all the time would you need a longer needle. You can use a regular needle. Another factor we sometimes run across in phlebotomy is people who have damaged or sclerosed or skewed veins. Skewed or skewed or obstacle veins do not allow blood to flow through them. Sclerosed or hardened veins are a result of inflammation, drug use, and disease of interstellar substance. Veins that have repeatedly punctured often become scarred and feel hard when palpated. These sites should be avoided because blood is not easily collected from them. Patients with sclerosed veins from heavy drug usage, you sometimes should use a longer needle to find a vein that is deep in the patient's arm and that is under all the scar tissue of the surface vein that is on top. In case of burn patients, this is a challenge to find a good vein to collect from due to scar tissue that is on the surface of their skin. The most important thing to remember when drawing on a burn patient is to have patience and to take your time to locate a good pliable vein to collect from. Thrombosis. Thrombi, which is plural form of thrombus, are solid masses developed from blood constituents that, that reside in the blood vessel. A thrombus may partially or fully obscure a vein or artery, and such exclusion will make venipunctures more difficult. If you notice a patient has a thrombus, a clot within the vein, the best solution is to draw either below or above the area where the thrombus is located, or just look for another area to draw from. Or sometimes they'll have a sign to say, don't draw from this arm at all, because they don't want it to dislodge and to travel through their bloodstream into their lungs. Allergies. Always check or ask the patient for any allergies. For some patients are allergic to iodine, alcohol, or other solutions that are used to disinfect the venipuncture site. Sometimes on the patient's hospital room door, there will be a sign stating what the patient is allergic to. It may be on their armband. If there is no sign on the door, it is important to always look at the patient's arm for a color code armband that is placed along with the patient's ID band. Chlorhexidine is used as an alternative to disinfect a venipuncture site when a patient is allergic to the other disinfecting agents that are commonly used for venipunctures. And yes, some people are allergic to alcohol. It is important to look for any patients that may be allergic to latex. Most hospitals, as well as outpatient laboratories, use all latex-free products such as gloves, tourniquets, band-aids, etc. Hardly anybody uses latex anymore. Everything is now the nodule gloves or latex-free gloves, latex powder-free gloves. Exercise. The effects of exercise on a laboratory test depends on the intensity, duration, and frequency of exercise, as well as the individual's genetic factors, ethnicity, age, gender, hormonal status, and body weight. Effects of exercise on laboratory tests can be categorized as either short-term effects or long-term effects. These effects can only be interpreted by the physician themselves. Exercise also has some effects on homeostasis. Remember, homeostasis is an even keel of all your hormonal body needs, meaning your body is in a constant harmony with itself. Everything is functioning properly, from your heart, your electrolytes, liver, kidney, everything. It functions at a stable, maintained status. Patients who exercise show results of elevated electrolytes, glucose, BUN, creatine, uric acid, and other levels. There can also be an increase in white blood cells, uh, neurophilias, monocytosis, and decreased lymphocytes from patients who exercise. Patients should not exercise for at least 24 hours before blood work is collected so that the results can show some normal levels of the tests that are being performed. Stress can cause other abnormal factors to your blood work. Patients are often frightened, nervous, or overly anxious, especially prior to blood collection. Stress can cause an elevation in white blood cells, a decrease in iron level, and abnormal hormone levels. Mental anxiety can increase blood concentration of ammonium, fibrinogen, glucose, cholesterol, and insulin levels. Hyperventilation in a patient can cause increased lactic levels and increased fatty acid levels. Some patients suffer from a clinical syndrome called white coat. This is when a patient has anxiety or panic attacks whenever they are in a doctor's office, lab, or any medical facility. It is very important to talk calmly and to have patients who have this syndrome. Diurnal are rhythms and postures. Diurnal rhythms, which are body fluid fluctuations during the day, cause some hormone levels to change depending on the time of day, such as um, ACTH, TSH, which is thyroid, T4, plasma renal activity, progesterone, triglycerides, testosterone, bilirubins, insulin, iron, um, cortisol. All these types of tests are usually time tests because we have to do them during a certain period of time in order to get an accurate blood count level on them or an accurate number on them. Collection of time tests is very important that they are collected on time. If not collected on time, it can cause erroneous results. Posture change are also known to affect some laboratory test results, such as estrol and plasma renal activity. Blood collection should be performed in stabilized posture conditions, changing from a supine or lying position to a sitting or standing position cause blood water to shift from intravascular to intracellular compartments in tissues. Enzymes, proteins, lipids, iron, calcium levels are significantly increased with changes in posture. Positional phenomena is a posture-related condition with changes in hematocrit and hemoglobin results. Posture positional posture of phenomena has to be differentiated from the results of acute bleeding that can lead to true anemia. When collecting an H&H on a patient, the doctor sometimes orders more than one within a day to see the difference from when the patient was in bed from when the patient is up and moving around. Travel issues affecting laboratory results. It is very important to ask a patient if they have traveled recently. Traveling can sometimes affect patient labs, especially if they travel through different time zones. If a patient traveled on a plane for more than 10 hours, sitting for a long period of time can cause fluid and sodium retardation, which takes approximately 2 days to return to normal. Age. Laboratory test results vary considerably during the stages of life: infancy, childhood, pediatric population, adulthood, older adulthood, geriatric population. Mastectomy. It is important to always collect blood on the opposite side of where a mastectomy was performed. Mastectomy, which is the surgical removal of the breast, often have swelling caused by lymph accumulation in the tissue, lymphedema, on the side of the surgery because of lymph node removal. Due to high risk of inflammation or infection, a patient can't be cut, scratched, burned, or blood collected on the same side as the mastectomy. Edema. Healthcare workers should avoid collecting blood from these sites because veins in those areas are difficult to palpate or locate, and the specimen may become contaminated with fluid. The swelling can be localized, for example, fluid leakage from an IV line, or diffuse over a large area of the body. Patients with edema have swelling because of either heart failure, renal failure, inflammation, malnutrition, bacterial toxins, medication, or allergic reaction. Menstrual cycle. Due to women being on their menstrual cycle, menstrual blood loss is a single most common cause of iron deficiency anemia. If a patient is on their menstrual cycle, it is important that when collecting a blood sample, it is to only draw the minimum amount that is needed to run adequate test results. Medication. Blood being collected to determine levels of medication should, in most cases, be collected just prior to the next dose. When checking medication levels to see if the prescription medicine is working the correct way, a physician will tell the patient that they can't take their medication 24 hours before labs are being done. Interference of drug and other substance in blood. Many prescribed drugs can interfere with clinical laboratory determination or can physiologically alter the level of blood constitutes measured in the clinical laboratory. Interference of drugs and other substances is so complicated and dependent on the chemical procedure used that only general recommendations are described. Physicians must work closely with pharmacy and laboratory staff to rule out laboratory test results that are altered because the patient is taking medication. Over-the-counter drugs such as aspirin affect specimen collection and causing the patient to bleed excessively. FYI, patients that are being treated with blood thinning medications such as heparin or warfarin can experience excessive bleeding. Different medication can affect lab results and cause the patient to have increased glucose levels or even increased cholesterol and triglycerides. Alcohol consumption can also affect laboratory results, especially in hematology, because alcohol thins out your blood as well. It is very, and let me repeat this, it is very important to document on lab results that the patient has currently on medication prior to labs being drawn. Very important to document. If lab results come out at normal, the doctor will know why. Infections. When dealing with patients who are infectious, a phlebotomist must always remember not to touch the patient once the site has been cleaned. Infections can be spread from one patient to another if the phlebotomist is not careful with the handling of supplies and equipment. It is important for the phlebotomist to wash their hands before and after blood collection, and if a sink is not available, always carry hand sanitizer with you until you can get to a sink and soap to wash your hands. It is also important not to open supplies or sterile equipment before you are ready to collect a sample. If the packages, band-aids, needles, tube holders, etc. are open ahead of time, they may become contaminated and could lead to an infection in the patient themselves. If a patient is vomiting, sometimes a patient can become nauseous due to the sight or thought of blood coming out of their body. If a patient experiences nausea, talking to the patient in a calm, soothing voice, telling them to take slow, calming breaths, along with a cold compress placed on their forehead, can sometimes help a patient that may be suffering from nausea. It's important that you document and inform the patient's doctor or nurse if this happens. Other factors that can affect the patient are simply as that can affect laboratory results are such as gender, pregnancy, for instance, have an influence on laboratory tests. Geographic factors such as altitude, temperature, and humidity can affect baseline values. If there are any changes to that can affect the normal baseline values of a laboratory test, it is important to follow procedures or consult a supervisor when necessary. Complications with test requests and identification. The biggest thing sometimes we have, especially in South Louisiana, is patient discrepancies due to the fact that the older generation, most of our geriatric patients have almost the same name. You'd be amazed how many Mary Elizabeth Rose you'll come across in the time that you work in a hospital or an outpatient lab service area. And the thing of it is, we have to be very mindful and very critical on identification of patients due to that one interesting fact that we have a lot of people who have a common name and they just might have a different birthday. It's very rare that you run across somebody who has not only the same name but the same birthday. It does happen. It's happened to me at least twice, but it's rare, but it can happen. Improper identification is the most dangerous and costly error a healthcare worker can make. If you do make this error, please be wise enough to please disclose that you made a mistake. Don't wait till the results come out and this patient gets the wrong patient gets medicine that they didn't even need and cause even a bigger catastrophe because that patient might lose their life by receiving blood that they didn't, or receiving a medication or treatment that they didn't really need. This can lead to errors such as loss of life from an acute hemophilic transfusion reaction, delayed diagnosis and additional blood collection and laboratory testing, treatment of the wrong patient for the wrong disease. Joint Commission main goal is to improve the accuracy of patient identification through the use of two identifiers methods. The two identifiers that can be used are verbal confirmation of the patient name and date of birth, patient's photo ID, patient's wristband. A patient's bed label, water pitcher, or drawer chart should never, ever, never be used as one of the identifiers because it might have been left from the previous patient from before and they just never removed it. A phlebotomy is the first to detect any discrepancy between the name on the requisition and the name that the patient verbalized or the name on the armband, which is true. We are the first to see this. If a discrepancy is found, it is very important that the charge nurse or supervisor be notified about the error and for them to correct it before we even stick a needle in that patient's arm. We are not allowed to stick a needle in that patient's arm unless everything matches up. If it don't match up, we do not draw. Time of collection. Time tests are important in monitoring of certain medications, drug levels, cardiac enzymes, as well as morning specimens have to follow a set time for the results to be accurate. If a healthcare worker is running late in collecting the time test, it must be documented in the patient's chart the time it was collected so the doctor can make adjustments to the patient's medication if he needs to adjust it. Say the time test was for 10 o'clock and you didn't get to draw the patient till 15 minutes after 10, you must document that within the chart to say, and when I say documentation, meaning we go down to the lab and say that we drew the patient 15 minutes late. If we know we are running late, you can call the hospital floor and ask the nurse that, hey, a stat came up, I can't make it at 10 o'clock to draw this patient. Do you mind drawing the patient? 9 out of 10, the nurse will do it because she knows how important this time test is to the patient. So don't be afraid to ask for help. You are a human. Stats come before times. Requisitions. It is important to double check a patient's requisition just to make sure that the healthcare worker is collecting the correct specimen from the correct patient. If the wrong specimen is collected and a redraw is needed, this can lead to excessive blood loss, which can result in anemia in the patient. So before you draw, read your rec. Tourniquet pressure and fist pumping. Laboratory test results can be falsely elevated or decreased if the tourniquet pressure is too tight or is maintained for too long of a period. No more than 1 to 2 minutes can a tourniquet stay on a patient's arm. The pressure from the tourniquet can cause biological anions to leak from the tissue cells into the blood or vice versa. A tourniquet should not be on a patient's arm no more than 3 minutes when collecting blood. Tourniquets should not be placed on a patient's arm too tight. This can lead to elevated iron, lipid, protein, and potassium levels. The pumping action of a patient's fist before a venipuncture should be avoided due to this can lead to an increase in the plasma, potassium, lactic, and phosphate levels. All right, failure to draw blood. What if you fail to draw blood? You're human. It's going to happen. But sometimes there's little things we can do to correct the little mistakes if we fail to draw blood the first time. There are several factors that can cause a healthcare worker to miss the vein in a patient's arm. These factors include maybe you didn't insert the needle deep enough. Pull it a little bit. You inserted the needle too far into the vein. Pull back a little bit. Holding the needle bevel against the vein wall. If you feel a vibration in your needle, that means you're up against the cell wall, the vein wall. Pull back from it, and blood will start flowing into the tube. Losing vacuum in the tube. If you know you are in the vein and there's no blood coming into the tube, but you know 100% positively you are dead center in that vein, before you pull the needle out, change out your tube. Double check. Because sometimes, these tubes are filled by a machine. The vacuum is filled by a machine, and machines can go faulty. They're supposed to check the tubes before they ship them out. But like I said, things happen. It's a machine. So sometimes they don't have the appropriate vacuum that is needed in the tube. Change your tube out. Maybe you had a faulty tube. Just like sometimes we have faulty tourniquets and they pop before we even put it on the patient. Hence why we stretch it out before we put it on the patient to double check to make sure it's not a faulty tourniquet. It happens. Are just a few that can cause a healthcare worker not to be able to collect blood. These factors can easily be corrected. As I stated, if you didn't put the needle in enough, push it in some more. If it's too far in the vein, pull it back. If you lose vacuum, change out the tube. If you're up against a valve, pull back. But never, ever, please, never ever probe or dig in a patient's arm. If you have done all the above tricks, just simply remove the needle and start all over again. Just remember you only get 2 chances to collect blood from a patient. Remember that. 2. Strike 2, you're out. Never 3. Sometimes you come across a patient who is a fainter. It happens. No matter what they do. They eat, they don't eat. It's just something about labs that make them pass out. Just go cold. It's nothing to do with your technique. It's not your personality. It's just their body's reaction to getting labs done. It's like a psychological reaction. So you might experience patients who have fainting or syncope episodes. Syncope is a transient or frequency sudden loss of consciousness due to a lack of oxygen to the brain and results in the inability to stay in an upright position. If you know you have a patient who is a fainter, and they will tell you, oh, I pass out every time I get blood, we are supposed to lay them down in a supine position with their feet elevated and their head down so that they can always get a blood flow to the brain. We're also supposed to talk to the patient to get them to remember to breathe, because sometimes the whole purpose of them passing out or fainting is because they hold their breath the whole time you're doing labs. Not a good thing. So we always talk to the patient. It is always talk to the patient, especially if they're starting to feel faint. If for some reason they do faint, always be prepared to hurry up and remove all equipment from the patient. Remove the needle, pop the tourniquet, remove the needle, tape them up as fast as you can, and to make sure that you elevate them up and keep them from falling. We used to have ammonia tabs where we would put ammonia under their nose, but they're finding out that that is too much of a shock to the system, so they're not allowing us to do that anymore, due to the fact that it's a sudden shock to the system to wake them up, that we have to let them wake up naturally. The only thing we have to do is monitor their pulse and to make sure that they are breathing still. So before blood collection, always ask the patient if they have any issue with blood collection. And most of the time they'll tell you before you even ask them, hey, I'm a fainter. And you'll be like, okay. And you'll know what to do. So they'll tell you. Most of them who know they pass out when getting labs, they will reassure you before you even ask. If you do work in an outpatient situation, we always have some type of cold towel compress or ice to make a cold compress, and we always have juice or water to help, or sometimes crackers to help build up their sugar level. It helps them get a sugar rush, so their sugar will pump out, not sugar, so their red blood cells can pump it into their body and get their color back into their system. Hematomas, they happen. Even the best phlebotomist can cause someone to get a hematoma. We try not to. That is the most things we try not to do, but it does happen. It's not the improper way of you drawing all the time. It's just sometimes their skin is just so fragile. Hematomas are simply swelling of blood that has leaked into the tissue under the skin. Sometimes you can cause a hematoma, especially on a geriatric patient, due to the fact that geriatric patients have very thin skin and it's easy to cause a hematoma. The thing to remember is always use a smaller gauge needle to help minimize that chance of causing them to have a hematoma. But like I said, sometimes you can do the proper procedures and cause a patient a hematoma, and not intentionally, just by accident, due to the fact that they have very thin skin, or they might be on blood thinners and their blood is thin already. It may be too thin, and hence why they're bruising as soon as we stick them. Um, Another thing we have to worry about is petechiae. Petechiae are small, red, smooth, hemophilic spots appearing on a patient's skin, which can indicate that minute amounts of blood has escaped into the skin. This can be caused by a coagulation abnormality such as thrombocytopenia or a low platelet count. Excessive bleeding. Excessive bleeding can be caused if a patient is prescribed a blood thinner. When a healthcare worker goes to collect a blood sample, it is important that the patient informs the phlebotomist that they are on blood thinners so that they can take special precautions. Blood thinners such as warfarin, Lavaquin, all those new blood thinners that they're coming out with, even if they say they take a baby aspirin every day, baby aspirin is still considered a blood thinner. If the patient does state the fact that they're on blood thinners, you have the right to ask a patient if they are one. If they don't voluntarily tell you, you can ask them. That should be part of the questionnaire you ask a patient. Besides, can I get your first and last name, your date of birth? Um, have you had your blood drawn before? Another question is you're supposed to ask, are you currently on any blood thinners? You're always supposed to ask the patient that also. If they are on one, the last thing you want is for a patient to bleed out on you as they are leaving your site. Excessive bleeding can lead to shock or even fainting, so it is very important to monitor your patient once you have completed the blood collection. Make sure when you have a patient who is currently on blood thinners that you take the time instead of maybe the 1 to 2 minutes you sometimes have to do in order for them to stop bleeding. Sometimes it may take 2 to 3 minutes or sometimes 4 to 5 minutes for them to stop bleeding. And it also causes them not to have a hematoma, because the last thing we want to do is for a patient, especially an outpatient, for them to get up from the chair and all you see is all of a sudden their good shirt is ruined because blood has seeped through from the venipuncture site. And sometimes you can stop the blood flow and it's not flowing, and as soon as they move, it starts up again. So there's some things we can't prevent, but there's some things we can, and that's one of them, to make sure that they have completely, utterly stopped bleeding, especially if they are on blood thinners. Nerve complications. When a phlebotomist is looking for a vein, just make sure it is a vein and not a tendon. Please make sure it's a vein and not a tendon. Remember, a vein is a bouncy ball. A tendon is correct, like cordy. It's very cordy and it's very tough. It won't bounce. The best way to tell the difference when you are feeling for a vein is it will feel spongy and bounce like a baseball or a basketball, not a baseball, basketball. If you by chance stick a tendon, you can cause some nerve complications to a patient, which the patient will feel a burning sensation in their arm or a tingling going down their arm into their hands. If this happens, immediately release the tourniquet and remove the needle from the patient's arm and hold pressure over that site until the tingling sensation has gone away. Sometimes it does happen. I'm not saying all the time. You can be right next to a vein and that vein somehow shifted, and when you went to stick, it shifted and you nicked the tendon. It happens to the best of us. The main thing to remember is not to lose your cool and panic. Just follow protocol and procedure. Simple as that. If a patient goes into a seizure during blood draw, the first thing to do if a patient goes into a seizure is please release that tourniquet and remove the needle from the patient. Hold pressure on that site and gently move the patient into a supine position. If they have not fallen already, make sure you call for help. Do not put anything in the patient's mouth unless you are authorized to do so and have the experience to handle a seizure patient. Us as phlebotomists, if a patient goes into a seizure, we let them convulse. We just make sure that the airway, the pathway is clear, that they're not going to hit anything during their time of convulsion. Once they have finished with their convulsion, especially if help hasn't arrived by then, we have to make sure that the patient is still breathing at an adequate rate and that their pressure is at a stabilized rate. Hemoconcentration. Hemoconcentration is a decrease in plasma volume with an increased concentration of cells in larger molecules. This can be caused by several factors, one being a prolonged tourniquet application, where the tourniquet on the patient arm is on there for longer than 3 minutes, massaging, squeezing, or probing a site, long-term IV therapy, and sclerosed or obscured veins. These sites should be avoided, for they can put the patient's safety at risk and they can compromise a lab test result. So if a patient has an IV, we are not to draw in that IV arm at all. We're supposed to go to the opposite side. Intravenous therapy. Patients who have an intravenous therapy for a long period of time run the risk of having veins that are damaged or sclerosed or blocked. It is important to remember to never collect a blood sample from the side with the IV in it. Sample can be diluted with IV fluids and will make the test results at normal. If you must draw from the same side as the IV, you must ask the nurse to shut the IV off for at least 2 minutes prior to blood collection, and you must draw below the IV site for less contamination of IV fluids. Also, before collection of blood can be done, you first must draw a waste tube, which is the red tube with no additive. Then the ordered labs can be collected following the correct order of draw specified per site. A note should be written on the label stating that the labs were collected on the same side as the IV site. This is to let the med techs know, just in case some results come back erroneous. Hemolysis. Hemolysis results when red blood cells are lysed or broken apart and is destroyed. Hemoglobin is released and serum, which is normally straw colored, becomes tinged with pink or red. Hemolysis can also be caused by sickle cell disease, exposure to drugs or toxin, artificial blood valves, some infections, collapsed veins. Sometimes when a phlebotomist goes to collect blood from a patient, their veins may collapse in the middle of a draw. This is caused by either the forceful or quick withdrawal of blood during a venipuncture, especially if the patient has small veins. Always look at the patient's arm before choosing a needle size to draw with. If you notice that the patient has small veins, you have a choice to either collect the blood by syringe or with a butterfly needle. The force with using these two methods is less and have less chance of the vein to collapse. Improper collection tubes is another cause of medical errors. The most common mistakes that phlebotomists make is drawing an incorrect tube for a certain lab test. That's why we always look at our requisition and make sure we have all tubes that are needed. If in doubt, always look it up. When you are not sure about a lab test as to what type of tube needs to be drawn, there are reference labs on the computer that can help you. The most popular reference lab is Mayo Online. You just type in the test name of the test and it will tell you what type of tube is needed for that test and how many milliliters is needed to have a successful test result. Look at examples of blood specimens collected in wrong tubes or wrong manner, which is on page 293 to 294, the last paragraph, and that'll tell you what tests are most commonly drawn in the wrong tube. I hope you enjoyed this lecture and good luck on your Chapter 9 test. Thank you and have a